Well, good morning, everyone. And once again, welcome to another live this morning, Q&A Friday. And nice to have you come on with us. I'm not going to say hello to individuals because I can't see your names anymore unless I have another phone with me. Sometimes I can do that, but I can't this morning. Anyways, guys, we love you dearly. Thanks for coming on. I'll wait a moment and just wait till you get your notifications to come on. Q&A, got lots of questions. I don't think we're going to get through all of them this morning from what I can see. Depends on whether I get into any rabbit trails or not. And you know me, I often do. So good to have you with us, guys. Thanks. And let's just wait a moment. And hello to everyone. And thanks again. You guys, by the way, are much appreciated by moi. Love my audience. Love you guys. Are you a member of the Martin private Facebook group? Join the 25,000 and others. Following on it, Facebook, we're at 89,000. I read this morning. 89,970. That's fantastic. We're going to have some kind of party when we hit 90,000 followers on Facebook. And then millions of downloads on The Doctor Is In. Again, where does that come from? That comes from you. Thank you for that. We appreciate you guys more than you know. And you know who you are, our faithful followers. We don't do the roll call as much as we used to, but you know who you are. Thanks for coming on. Okay, let's look at the first question this morning. Angie, this question, Angie, gets asked to me almost every Friday, okay? Because it's a good question, and I understand where you're coming from. And Angie is saying, Dr. Martin, you're the only guy that I know that says this. Okay. I often tell people, be leery if I'm the only guy that is saying it. But here's what I've said. Here's the question, and then I'll get into it. On your Candida podcast, yes, you mentioned to take oil of oregano daily. Okay. I'm the father of oil of oregano. Well, not really, but I probably promoted it and still do more than anyone else. Okay. Can you explain why it is safe to use daily, and does it not kill the good guys? Please. You seem to be the only one saying it. Well, let me give you an analogy, Angie. Garlic. Okay? Other than the fact that it gives you a bad breath, what does almost everyone know about garlic? It's antifungal, it's antibacterial, antiviral, right? Garlic. And can you have garlic every day? Well, if your wife or husband will allow you, because you're going to have, the side effect of garlic, fresh garlic or whatever, would be, I used to have patients come in. They take garlic every day. I remember this Finnish couple that were very good patients of mine. And they just swore by garlic and how good it was for you. I never argued with them. It's just that I knew they were taking it because I could smell it. But what's the side effect of oil of oregano? Oh, it kills the bad guys. No, it don't. Garlic doesn't kill your, excuse me. Yes, it does. I just made a mistake. Garlic is an antibiotic natural? Right? You read on it. You can even Google that. It'll tell you it is. But it doesn't kill your good bacteria, nor does oil of oregano. Oil of oregano is a natural antibiotic, a natural antiseptic, a natural antiviral, a natural antiparasitic, a natural antifungal. And I found over the years of my practice, Angie, it was the best. Better than garlic. It's a natural antioxidant too, by the way. It's nature's gift to man. Okay? God gave us a gift of oil of oregano. It does not kill your good guys. You can take that every day. I brush my teeth with oil of oregano. I put a couple of drops on my toothbrush. Goes right into the bloodstream through the gums. Excellent. Good for you. It does not kill your good guys. It doesn't create, unlike an antibiotic you get as medications, that doesn't differentiate. It kills, it's carpet bombing. It kills everything. Now listen, if you need an antibiotic, hey, I'm on your side. Take an antibiotic if you need it. I always tell people, somebody asked me last night, Doc, I got a UTI. Should I take an antibiotic? Is it burning? Yeah. Upon urination? Yeah. Well, maybe you need an antibiotic for a couple of days. Don't go past that. The second that doesn't burn, and a lot of people take antibiotics for UTIs because the doctor said you got a UTI because they did a urinary test. But you don't even feel it. Please, don't take an antibiotic at that time. Use natural. Because what you do when you take an antibiotic, you kill all your good guys too. And now you better replace that. Otherwise, you're going to get the invasion of the Third Army, the Trojan horse that comes into your system. It's a fungal. And I was saying to someone yesterday, whenever you get a urinary tract, I have almost seen no exception to this, especially in women. They have an underlying yeast infection in the bladder. And then the E. coli or whatever attaches to that wall. But if there was no yeast there, it wouldn't do it. That is why women especially get the recurring urinary tract infections. It's fungal. It's not even bacterial. And I don't recommend an antibiotic unless you're getting severe burning, because I don't want that thing to go up and affect your kidneys. But use an antibiotic smartly. That is, when you have symptoms, you see, for years, the pharmacist, and even on the label, make sure you finish this antibiotic. You know what the research is showing? That was never true, and it should never have been given like that, prescribed like that, because what happens is it kills all the good guys. Plus, the problem with antibiotics too, another problem, is not that it just kills all your good guys. It carpet bombs your good guys, your good bacteria that are on your side. The other thing it does, it creates superbugs. Let me see if I have this. Otherwise, I'll bring it up. If I have it very quickly, I will do it. I got my notes with me here because I was reading a study, okay, just recently. Let me just see if I can find it. If I can't find it right away, I won't do it, okay? Hold on. Okay, I got it. New study on antibiotic resistance. It kills, listen to this, antibiotic resistance caused by the overuse of antibiotics. The resistance kills 1.27 million people annually. It creates monsters, bacteria that become resistant. That's what C. difficile is. It's so difficult because it's resistant to antibiotics. Where do you find C. difficile? In a hospital. A hospital should be a safe place. But because of the overuse of antibiotics, and listen, guys, you know me. I think I'm very reasonable on antibiotics. If you need an antibiotic, it'll save your life, for heaven's sakes. But it's the overuse. Doctors prescribing it. Oh, take it till you finish all of the prescription. No. That's creating superbugs. And guys, I've been saying this for 40, almost 50 years about antibiotics. The greatest discovery of the 20th century is becoming the curse of the 21st. 1.27 million people annually. And that's just in the United States. Die from sepsis because an antibiotic couldn't be, it didn't have the effect, because on the bug, the bug has, there's superbugs that develop resistance. It's the overuse. And you don't want to get me going on antibiotics and leaky gut. So am I against them? Of course I'm not. I'm against the overuse of them. I'm against pharmacists who are not kept up, who haven't kept up on prescriptions, for heaven's sakes. And they give it out, the doctors give it out like candy, and the pharmacist should be telling you, take it for a few days and then stop, as soon as your symptoms have gone away. But this is where oil of oregano comes in. Oil of oregano is a natural antibiotic. I like it because it's very preventative, but even on a localized, on skin, internally, I love oil of oregano. I've been using it for a multitude of years. And I heard this when I had my radio show. Dr. Martin, Sudbury, Ontario, Canada. The number one place for sales of oil of oregano are in Sudbury, Ontario, Canada. Because of you. And I used to laugh about that because I talk about it all the time. But it does work, and it's so good for you. It's completely natural. It's an antioxidant. It does everything. Plus, there's no side effects to it other than it tastes terrible. It's strong. Of course it's strong. Right? I always used to tell my patients, suck it up, buttercup. Yeah, it's strong. So what? It works. Remember the Buckley's commercial? Yeah, it tastes awful, but it's good for you. Okay. Thanks, Angie. I hope I explained that properly, and I got off on a little diatribe, of course. But I know, am I the only one that still I'm still the only guy saying that? Even though I've been trying to educate people for 30, 40 years on oil of oregano? I'm the only guy that says you can take it every day? I don't know. I'm right. They're wrong. Alice, I suffer from hypotension, low blood pressure, and cardiomyopathy, and atrial fib. Man, you got real problems. Doctors always tell me to cut back on water. They probably have you on Beta blockers, they probably have you, I don't know, maybe not beta blockers if you got hypotension, but they would have you on diuretics. And then they tell you, well, don't drink water and cut back on salt. Well, look, I'm never going to go against what your individual doctor tells you to do, or your cardiologist. Salt ain't your problem. Sugar's your problem, because sugar's the one that makes you hold on to your salt. Yeah, it's sugar, not salt. Okay? If you're drinking water, salt, you usually, and you know, when you're on medication, you get dehydrated very quickly. So I don't want to go against your physician, your cardiologist. I just tell you that I disagree on that part of it. Now, the other thing is you should be on CoQ10, ubiquinol for sure, and magnesium for sure with the AFib. Check your levels, Alice, of vitamin D and B12, because I can almost guarantee you're low in both of those. So good for your heart. B12 and vitamin D with K2. Take your vitamin D with K2. And magnesium. Okay. Faith, hold on here. 10 minutes. Okay, Faith. The Whipple procedure, I know what it is, can be used to drain cysts in the pancreas that may not be cancerous. What are your thoughts? Well, Faith, look, I mean, yeah. If those nodules or cysts are bothering you, and they could, and they want to do that procedure, I mean, there's always side effects to that. I don't know what to tell you. I mean, I'm not telling you not to do it. I don't know. I don't have enough information. Are these things bothering you? Are they affecting your pancreatic enzymes? Are they affecting your ability to produce insulin? I need to know that to give you a more informed opinion. But you got to figure that out. I need more information, though, Faith. I do, because I can't tell you whether to go ahead with that or not without more information. And even then, I just give you an opinion. I wouldn't tell you to go against your doctor's recommendation, because you're not my patient. Craig, I'm 64 and have several bone nodules growing in my gums, a large one in the middle of my chest, on my sternum. What causes this? Well, there could be, are they lipomas? Are they calcium deposits? That can happen. Could be parathyroid. It's worth having that checked, because that usually controls your calcium levels. You may not, I mean, the antidote to calcium is magnesium and vitamin K2, because it will take calcium and put it where it belongs. Okay? So you may be low on vitamin K2. Remember, you get vitamin K2 in eggs, meat, and cheese. It's right in there with your calcium. That's to put the calcium that you're eating in an egg, in meat, in cheese. Lots of calcium in dairy. Everyone knows that. But you see, it's surrounded by vitamin K2. Now, you got to check your parathyroid. I'm sure, Craig. But I would have you on K2. You can take it right with the vitamin D. I'd have you on magnesium, for sure. Okay. Lisa. Whoop. I lost it here. Okay. Tamanetla. Lisa. Sorry, Lisa. I tested positive for H. pylori. Okay. I tried the quadruple therapy antibiotics. Yeah, they give you the horse pills. And stopped after 4 days. I felt terrible. You mentioned a broad spectrum probiotic. I did? I always mention it. Oil of oregano. Never heard of it. How much of each should I take? Well, listen, if you have H. pylori, here's what I would do. Okay? I'd have you on our broad spectrum probiotic. There's nothing better. I don't hate to say it. I just got to tell you. Those probiotics are our formulation. They're made for H. pylori too. There's certain strains in there that are go after H. pylori. Oil of oregano. So I would take for a month, if you have H. pylori, go high dose. 6 probiotics a day. 6 a day. I would do 3 or 4 drops of oil of oregano twice a day. Get it into your system any way you can. Then, the other thing you should be doing is taking our digestive enzymes. Why? Because in our digestive enzymes, we have oil of oregano in there to go after H. pylori and to help clear up SIFO. We have the ingredients in there, besides the enzymes, are really good for H. pylori. So I would do those 3 things. I would do those 3 things for H. pylori. I got great results with that. Okay? That was Lisa. Janine, what does Dr. Martin feel about the shingles vaccination, especially for seniors 80 years old? Like, shingles ain't no fun, okay, guys? Shingles is no fun. The vaccines, new study came out. Isn't it interesting? I think it was yesterday. I read a new study on the shingles vaccine. Some major side effects to that. So, I'm not telling you, you got to weigh that. You have to, Janine, weigh that. With the efficacy of the vaccine versus the side effects of the vaccine, I'd look them up, okay? Secondly, for me, okay, I'm a big guy on building your immune system. Janine, if your vitamin D levels are good and you take vitamin D every day, that is a tremendous natural vaccine. Because you're building up your T cells and your immune system. Get in the sun, really helpful. Vitamin D as a supplement, I would take about, especially if you're 80, I would be on 10,000 IUs of vitamin D. You should be on B12. That's very important, even for your immune system. B12, I would be on at least 4,000 micrograms of B12. Zinc. Okay, eat your steak. That's how you get zinc. Now, if you want to take zinc separately, about 50 milligrams of zinc. But you see, I like vitamin A and vitamin D and zinc. You get that when you eat steak, my friend. Okay? That's why I'm so big on eggs, meat, and cheese. To get vitamin A, you can't get vitamin A in the plant kingdom. It's not in there. I'm sorry. And you need vitamin A. Okay. Or get on our multi-nutrient. Has vitamin A in there. It has zinc in there too. Okay. Thanks, Janine. Okay, let me see if I can get... Kathy, I'm 68 years old. You're a puppy. My creatine is low. Okay, now, a lot of people get this mixed up. There's creatine kinase. Okay, I'm assuming, Kathy, that's you. Yours is low. What does that mean? Well, there's a good chance you're sarcopenic. Creatine, a lot of people take it as a supplement for muscles. It's very good for your brain too. And guess where you get creatine? Steak. Creatine is found in the animal kingdom. Your body makes it, but you get it when you eat the animal foods. Isn't that beautiful? You get creatine. If your creatine is low, your muscles are breaking down usually, Kathy. And you're young, 68, get strong. Get strong. Get stronger. Okay? Does creatine supplement help with osteoporosis? Indirectly, because creatine helps your muscles and muscles help bones. But there's no amount of supplementation that you will take a creatine that will do anything compared to actually getting stronger. Get your muscles stronger. If you need tensor bands or weights, or get strong, okay? I got push-up bars. I do push-ups. And I try and stay strong at my age, okay? Very important muscle for a lot of things, and especially osteoporosis. Thank you. And by the way, you see me? I go on rabbit trails and then I forget. Because a lot of people mix this up. They think creatine is creatinine. That's two different things altogether. Okay? So creatine muscle, creatinine levels are checking for your kidney function. Okay? So people mix that up. It's creatinine is not creatine. Okay? That's why doctors, I don't want to be negative, but when I say doctors, guys, not all doctors, okay, but some doctors and most doctors, because they don't study nutrition. Oh, well, if you get creatine in meat is bad for your kidneys. You're mixing up creatine and creatinine. They're two different things. Steak doesn't elevate your creatinine. Might elevate your creatine. Okay? That always bothered me because I still hear it every day. Well, my doctor told me I got kidney problems. I better cut back on red meat. No, cut back on sugar and crappy carbs. That's what's killing your kidneys. If you don't believe me, ask a diabetic. I get really uptight about that. Could you tell? Okay, let's see. I think I answered. Okay, I know I got a lot more, but I just wanted to see if I got them all. Okay. Beverly, my doctor said I have osteoporosis and he wants to put me on a medication, which I refused. Now they want to give me a needle twice a year. Also, vitamin D, they're actually recommending that. Well, make sure you take vitamin D with vitamin K2 for your bones, okay? So we have the perfect amount of vitamin K2 in our vitamin D. I would recommend you take about 8,000 to 10,000 IUs a day and get in the sun too, okay? And which I take calcium 1,200 milligrams daily. Beverly, I would not do that. Eat calcium. Don't take it as a supplement. It's not getting to your bones. It's not getting to your bones. I hate to tell you that. Calcium that you take in a supplement does not get to your bones. Take vitamin D with K2. Eat eggs, meat, and cheese. Lots of it. And then you'll get your calcium with vitamin K2 delivered. You want it out of your bloodstream. You take a calcium supplement, it's staying in your bloodstream. You don't want that. You want to harden your arteries? No, you want to harden your bones. So do it the way God wants you to do it. Eat eggs. You'll get your calcium with vitamin K2. And you'll get lots of it, by the way. And meat, especially steak. And dairy, especially cheese. And butter. Butter your steak, Buttercup. Okay? Butter your steak. And you will get a lot of calcium with K2 in nature to deliver calcium to your bone. You take a calcium supplement. Hey, by the way, I've been saying that for almost 50 years. Don't take a calcium supplement. I know it's popular as a supplement because doctors don't know what they're talking about. You need K2. Okay, Beverly, don't mind my diatribe. A doctor I follow, this is Dale, and that I respect. Okay, that's important, Dale. Says, for high cortisol, best not to have coffee till 10 a.m. Dale, don't you know what I think about that already? Why wait? They have this idea that coffee is hard on your adrenals. I don't know where they got that idea. Coffee is a natural antibiotic, it's got 1,000 phytonutrients in it. It's so good for you. Why wait till 10? If I had to wait till 10 to take my coffee in the morning, I would be in a bad mood. I get up thinking coffee. Okay? I get out of bed going, how fast can I have my coffee? But I don't allow myself my coffee until I have had 16 ounces or a half a liter of water. Because water is really important in the morning. Okay? And I've been doing that for a century. Not quite. Okay? Not quite. But I won't allow myself to have that coffee until I had my water. I know what they say about cortisol. You got high cortisol. Don't take your coffee till 10 a.m. It's going to make you worse. I don't agree with that at all, Dale. I don't get the science behind it. I know what they're saying, but that's assuming that caffeine is no good for you. Well, if you're worried about it, Dale, then have a decaf in the morning. Okay? Have a decaf. But you know what? Before that doctor, I know who you're talking about, ever studied adrenals, I wrote books on the adrenal glands because of chronic fatigue syndrome. And I'm telling you, I never told anyone not to drink coffee, unless it bothered them. Some people, you know what, Doc, I have a coffee, it bothers me. Well, then have a decaf. It's the bean that's good for you. I can't even have a decaf. Well, you're weird. Don't blame the rest of us because you're unique. Don't have it. Or, I don't like coffee. I feel sorry for you. No, I'm not putting a gun to your head, but I'm just telling you that the benefits of coffee are legion. It's so good for you, it's shocking how good coffee is for you. Not to me, but to people that I've convinced over the years with study after study after study. Coffee's good, and coffee's good for your adrenal glands. It really is. You want to wait till 10, Dale? Go for it. I won't. I'm not convinced. Anyway, yeah, I think you knew, Dale, what I was going to say. Anyway, I don't know. Okay. This Carlene, it's Carlene, Carlene. Well, Carlene, how are you? I'm new to the group. Well, welcome. We love you. Thanks for coming. We appreciate you. Okay. Your blood work showed that you were hyperthyroid. Okay. Too little iodine can lead. Okay. You're telling me, in other cases, trigger hyperthyroidism. You're saying iodine, okay? And iodine's important for the thyroid to work properly. And in hyperthyroidism, it's never too much iodine, in my opinion. I know they say that, but listen, I'm not big on just iodine. One of the things that makes the thyroid work properly, Carlene, is this, okay? Selenium, okay? Now, if you Google selenium, you'll see, it's good in Brazil nuts and seeds and nuts and, but I'm not big on that. I'm big on steak, because that's where you get selenium, in the best bioavailable form. When I find in thyroid, this has just been my years of experience, whether it's hypo or hyper. Now, I've done a lot of podcasts. I've answered a lot of questions on the thyroid. The thyroid's got a lot of strings attached. If you're a woman, I can tell you, Carlene, that almost invariably you got way too much estrogen, not enough progesterone. Your cortisol probably is way too high, and that can give you hypo or hyper, okay? And you can have fully autoimmune, which is Graves. But what I'm saying is this. I found over the years that the thyroid responds, whether it's hyper or hypo, to steak. Most people that have trouble with their thyroid, not all, but most, you know what their problem is? They're carboholics. Your thyroid was never made for that. They're sugarholics. High fructose corn syrup. It destroys your thyroid gland. Your body wasn't made for it. It doesn't know how to process it. Those bad oils. Your thyroid. All the stuff in the middle aisles of your grocery store, made with the hateful 8 oils that were meant for your car and not for your body, especially your thyroid. I'm telling you, you clean up your diet, it goes a long way. Then you'll get selenium. That will help. I wouldn't take, if you're hyper, I found like either hyper or hypo, as long as you're taking selenium, like we have it in our thyroid formula, and a lot of people with hyperthyroid have benefited from that. But you need to check your cortisol. You're probably very low in progesterone. And because the thyroid has got a lot of strings attached to it. You might have fatty liver. Your liver's gummed up. That's where T4 is converted to T3, mostly is in the liver. The liver has a lot to do with the thyroid. That's why the EMC, eggs, meat, and cheese, empty the liver. It really helps the thyroid. I've had tens of thousands of patients over the years that when they got on and got off the carbs and got on the fat and the protein, some vegetables, they really did well. It was amazing. They were shocked by it. Anywho, thank you for that question. Okay, let me do one more this morning here. Teresa, okay, I have gastritis. So they say, and it ain't me, don't eat fat or acidic foods. No. Okay, Teresa, I'm glad you asked the question, because it's a good question, and I know what they say. They are wrong. Gastritis, by the way, the biggest effect on gastritis. Now, you could have a bug, but people that get gastritis is because they're eating too much sugar. That is not, it's not because it's just, you want your stomach to be acidic. You need that acidity when you're eating meat, especially protein in meat and eggs and cheese. You need that extra acid. It's good for you. You get gastritis when you don't have enough acid. Now, again, you got to make sure you don't have an H. pylori or whatever in the stomach lining. But even then, like acidic foods, like, you know what, be your own doctor in a way. Teresa, if you find you have things that bother you, well, then be careful with them until you fix your stomach. Yes, digestive enzymes would be helpful. You look at our digestive enzymes, okay, called, what is it called? I can't even remember what it's called. Gutties, isn't it? Is it? I can't remember. It's digestive enzyme. But we put a broad spectrum of enzymes in there. That's the key. A lot of lipase and lots of amylase and lots of different protease to break down that protein in your stomach. So it is very helpful. Okay? I like, when you got the actual gastritis, I like aloe vera juice too. Okay? Take a tablespoon or two of aloe vera juice a day. I found that to be very good with gastritis too. Okay. Okay, I'm going to leave it there, guys. I'm on the road and we'll shorten it up. Well, we've already had a fair, but I got more questions. So guess what? Monday we'll continue on with the questions. Don't hit the panic button if you didn't hear your question today answered. We'll get to it on Monday. I promise. Okay. Guys, I got to breathe here. Because I just talk. I love you guys so much, you have no idea. Thanks for all the good questions. Okay, sometimes I tease you a little bit. Okay, just remember that's me, okay? It's not because I don't love you, it's actually because I do love you. Okay. Talk to you soon.